9.2 Introduction. When Sarita feels upset about something, she usually starts humming some songs and these come automatically to her mind. The interesting thing is that the songs coming to her mind reflect the mood she is experiencing that time. When she had a heated argument with her boyfriend and they did not talk for an entire day, her mind was humming sad songs. Whereas on another occasion when she won a prize in a quiz competition, she was so happy and cheerful songs were coming to her mind. Most of you may be resonating with the above example. You also might have experienced that your mood reflects the songs that come to your mind automatically. Some of you may also be taking to drawing something or coloring things or even engage yourself in playing and dancing. Music, art and play are expressive forms of art which helps one to express oneself, one's emotions, anxieties, fears, worries and uncertainties. You may also dance away your stress and do exercise, take a walk outside, or play musical instrument to release the bottled up feelings and inner turmoils. These different forms of arts can be used in two ways. First is for self-expression, where you engage in a creative pursuit to gain satisfaction and enjoy a state of inner peace and happiness. Secondly, for therapeutic purpose, where these expressive arts can be used for cathartic purpose to release the pent-up emotions, develop a clear understanding of self, and gain new perspectives. This helps them to achieve better emotional and mental health. In this unit, you will learn about 3 forms of expressive arts therapy such as music, art and play therapy. In the next unit, you will learn about 2 more expressive arts therapy such as dance and movement therapy, and drama therapy. 9.3 Music therapy. Whether it is a child listening to nursery or a teenager listening to their favorite song, the effects of music on human mind and emotions is no secret. Music has been understood as a medium of expressing all kind of different emotions, and this can be seen from the different genre of music that a person would listen to depending upon their moods. For example, when a person is excited, happy or in love, they would listen to romantic love songs. But the same person would listen to a sad song in case they have a fight with their lover, as you saw in the example in the beginning. Music has been a part and parcel of Indian culture, part of every occasion and festivals. Stories of the great musician and singer Tansen in Emperor Akbar's court are known to everyone. It is said that Tansen could get the clouds to rain by singing Mere Mala Raga, or light diyas, candles, with Deepak Raga. He composed Raga Darbari to help the king relax and relieve from his tension after busy day. Such was the power of Tansen's music and singing. All of you must have seen this scene from the classic movie Titanic, where the violinists used the power of music to play relaxing composition to help calm the passengers while they were facing death. This power and potential of music, when formally realized and used in evidence-based manner to respond to a client's emotional, psychological and physiological needs, is known as music therapy. To administer the appropriate music therapy, the client's needs are analyzed by a qualified and trained music therapist to develop an individualized and specific plan for each client. 9.3.1 Defining music therapy. Music therapy is different from just playing and listening to music. In music therapy, there is a purpose behind playing or even selecting a particular musical piece. Music acts as the mode of communication between the client and the therapist, especially for patients who have speech difficulty or general difficulty in expressing through words. Music therapy helps in providing an outlet for expression of patients' thoughts and emotions, and meeting the patient's family members' emotional needs as well. One of the pioneer researchers in music therapy is Kenneth Brussier, who wrote a book to illustrate the concept of music therapy and its complications. Brassier defined music therapy as an interpersonal process in which the therapist uses music and all of its facets to help patients to improve, restore or maintain health. The formal recognition of the beneficial effects of music therapy led to the development of an recognized and approved music program by the American Music Therapy Association. Music therapy is the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship. To define any therapy and to find one single definition to cover all aspects of a therapy is always challenging, and this is true for music therapy as well. Music therapy is a complex concept to be described by one single line definition. However, music therapy should not be confused with the concept of music medicine. Bratter and Dileo state that music therapy is performed by qualified music therapists. However, music medicine sessions can be conducted by health professionals. For example, a music therapist has studied and qualified to be a music therapist. They develop the treatment plans based on music therapy. But let's say a nurse plays music for a patient as part of the treatment plan. That is essentially music medicine, where music is used as a medicine for the patient's better mental health. 9.3.2 History of music therapy. The use of music in a therapeutic way is not new to mankind. Music has been used as therapy since a long time, but music therapy as a distinct branch of therapy has gained momentum over the last few decades. Use of music for the purposes of healing and treatment can be found in many religions like Hinduism and Jewish. The remedial powers of bhajans and hymns are illustrated in many stories mentioned in Hindu religion. Bhajans and hymns are recognized as a form of holy connection between the god and his devotee, which acts as a mode of communication between them. This allows the devotee to feel relaxed and it enhances their mood, which helps in their healing on an emotional level. Similar references can be found in the Jewish Bible, where an accomplished musician David plays the harp to remedy the king's mental health. Even the great Greek mathematician and philosopher, Pythagoras, recognized the benefits of music and was known for prescribing range of music scales to treat various medical and mental health issues. The treatment of wounded soldiers after both the world wars with the use of music is said to be the first time music therapy was officially recognized. The American Music Therapy, ND. Nurses treating the soldiers noticed the significant improvement in the physical, emotional and mental well-being of the veterans that they requested for more skilled musicians. However, it was recognized that musicians needed some form of training to effectively use music therapy, which led to the development of formal music education. 9.3.3 Benefits of music therapy. Studies have revealed activation of different parts of the brain when listening to music or playing a musical instrument. For instance, the memory aspect and experiences related to music are controlled by the hippocampus. The motions involved in playing musical instruments is controlled by the cerebellum, while the visual cortex is utilized for comprehending music. Benefits of music therapy have been observed in a wide range of physical and mental health issues. Music helps lower hypertension, increase muscle relaxation and lower heart rate by calming the patient. The emotional benefits of music therapy are equally significant and range from reduced stress and fatigue to improved pain management. Development of communication skills, increased concentration and memory retention are some of the known cognitive benefits of music therapy. Positive response to music therapy on cognitive skills were evidence in study conducted on children with autism and neonatal care. A similar research involving children in post-operative care and recovery in age group of 9 to 14 conducted at the Lurie Children's Hospital of Chicago found that children who were allowed to listen to their favorite music reported lesser pain. A young patient at UCSF Benioff Children's Hospital listening to a song played by music therapist, Oliver Jacobson. The selection of appropriate music and the choice of music used in music therapy sessions has an impact on the results achieved through music therapy. Each individual is unique and so are their music choices. Thus, the selection of music and the assessment of the music choices plays a vital role. It is like having individual treatment plans for each individual based on their needs and choices, as this gives a sense of autonomy to the patient, allowing for greater results with the therapist playing an active role in making such selections and treatment plans. Factors affecting these individual choices and music selection by the therapist can range from age, gender, personality traits, family background to the mental state of mind and present conditions of the patient. Music makes people happy with the release of hormones such as dopamine, endorphins, and cortisols. Hence, music has the potential to make people feel the pleasure and reduce their pain sensation. It has been found to have similar effects like drugs, alcohol, and sex. Also, music helps in neuroplasticity of brain. It can induce structural and functional changes in the brain, helping patients recover from brain damage. Music therapy addresses problems in communication also, as it gives people with verbal communication problems a mode of expressing themselves through their music choices. Further research conducted by Nguyen confirmed the beneficial effects of music therapy for numerous health issues like mental health issues, emotional stress, depression, overcoming stress-related disorders, handling trauma, memory loss, physical pain, chronic diseases. 9.3.4 Approaches to music therapy. Behavioral music therapy. The use of music therapy to improve or change behavior based on behavioral theory can be described as a behavioral approach to music therapy. Music therapy is used for achieving positive, or appropriate, behavior and to eliminate negative, or inappropriate, behavior. The therapist uses music therapy as a method of reinforcement depending upon the patient's need. Take a case scenario where the therapist will play the choice of music selected by the patient if they followed their treatment plan. On the other hand, the option to listen to music may be taken away if the patient does not behave in accordance with the treatment plan. In simple words, it is like a token system, as music is the token which may be rewarded to the patient or taken away as a form of punishment. This approach has the simple aim of using music therapy for behavior management. The approach can also help in improving academic achievement and social interactions. For any method to be considered as effective, it is essential to have some kind of standards against which it should be evaluated. It is not possible to have fixed evaluating standards in music therapy. However, Madsen mentions a few steps in the evaluation process used in music therapy. First is the identification of the behavior that needs to be eliminated or reinforced. It reflects the therapist's goal and targets from the treatment plan. What is it that the therapist wants to achieve from the therapy? After the identification of the behavior, the therapist would find a way to evaluate it and measure the changes that have occurred. The therapist would determine the ramifications of the changed behavior. This process is known as consequent. Fixing rewards for the changes in behavior is done by the therapist. It could be something as simple as playing in a get-together. Assessing the overall effects of the treatment would be the final step in the behavioral approach therapy. Developmental music therapy. Another kind of approach to music therapy is where music is used to help with psychosocial growth issues being faced by the patient. These could be interpersonal issues, cognitive skill issues, and sensory motor skill problems. This approach follows the concept of use of music as a medium of communication. Edith Box-Hill mentioned the aim of this approach is to enhance all domains of functioning, motoric, communicative, cognitive, affective, and social, always with a view to nurturing the human being as an entity, as a whole that is greater than its parts. Medical music therapy. When music therapy is used in medical facilities, then this approach is medical music therapy. While the medical facilities treat physical issues of the patient, the emotional and psychological well-being of the patient are guided through the use of music therapy. However, as mentioned earlier, music therapy should not be confused with music medicine. Playing music to relax people in the waiting rooms of hospital is one example of music medicine. Music for patients who are going to undergo surgery is another example of use of music medicine by health professionals. For instance, the playing of music by doctors and nurses in the hospitals in recent COVID-19 pandemic demonstrates the use of music to make them feel good, cheerful and uplift their spirit. In contrast to this, music therapy is conducted by qualified music therapists. While music medicine is restricted to playing music with an aim at healing, music therapy is used as an intervention which involves different aspects like creation of treatment plans, composition of music with great emphasis on the relation between the therapist and patient. The achievement of overall well-being for the client is the main goal. One specialization available within medical music therapy is using it for neurological problems. The aim is to help patients with mental health issues like Alzheimer's, dementia, etc. We have mentioned some common approaches to music therapy, however, the list is not exhaustive. There are many other approaches to music therapy like humanistic approach, etc. 9.3.5 Music therapy in India. Music therapy is a relatively new concept which is in its nascent stages in India, even though importance of music is widely recognized in Indian culture and since ancient times. There is still a long way to go before music therapy is accepted as a qualified field of practice which requires formal education. The Indian Association of Professional Music Therapists started in 2011 with 10 members. World Federation of Music Therapy, WFMT, 2013. There are only 2 schools in India which educate in music therapy. The Indian Music Therapy Association, IMTA, began operating in 2018 with the aim of spreading awareness about music therapy as a qualified field of practice. All members presently working as musical therapists are part of the association. The overall goal of the IMTA is sharing information about music therapy amongst people, creating and developing formal education programs for music therapy, conducting further researches into music therapy, and to provide a connecting platform to all the members. 9.4 Art therapy. Art therapy is one form of expressive therapy which involves the use of different art forms for achieving mental, physical and emotional well-being. Expression through art gives an outlet for our feelings and thoughts. It helps in bringing the inner anxieties on the surface. Like music, art has been around humans since ancient times. Adrian Hill was the first person to officially coin the word art therapy in 1942. Adrian found the positive effects of utilizing art therapy when he was down with tuberculosis. He found a way of expressing himself and relaxing with his paintings. During those times, art therapy was mostly utilized by medical professionals and psychologists, but there was no formal training or qualifications. Margaret Norberg, the founder of American Art Therapy Association, is known as the mother of art therapy and is a pioneer in this field. She realized the power of creative expression and believed it to be similar to verbal communication. By use of clients' imaginative skills, the therapist is able to understand the client's hidden, concealed or true feelings. The combination of the creative expression with verbal expression facilitates the recovery process. 9.4.1 Defining art therapy. Art therapy is a technique rooted in the idea that creative expression can foster healing and mental well-being. The American Art Therapy Association defines art therapy as an integrative mental health and human services profession that enriches the lives of individuals, families, and communities through active art making, creative process, applied psychological theory, and human experience within a psychotherapeutic relationship. Thus, art therapy involves the therapeutic use of art by the therapist for people, who suffer from mental health-related problems, challenges of living, and also, for those seeking personal development and enhancement. Thus, there can be two approaches to art. One is art as an expression of self which focuses on creativity, artistic quality, and aesthetic aspects. It leads one on the path of discovering oneself and self-actualization. It has the healing qualities of getting in touch with one's emotions and one's inner being to reach a higher version of oneself. It can be used for improving social skills, improving confidence, developing intellectual capabilities, promote cultural change or improve communication skills. The other approach is using art to delve into the subconscious part of an individual, focusing on what they are projecting onto the contents of their art. Analyzing what they are trying to express through art helps the therapist to know the underlying emotional problems. For instance, if a child is having issues expressing himself verbally, or has apprehensions or fears and may be hiding true feelings for any reasons, the expression through art gives an outlet for her/his feelings and thoughts. It is important to note here that for conducting art therapy, the art therapist needs to be professionally qualified and trained. However, the client doesn't need to be professionally trained or creatively talented. The use of art therapy helps develop the creative skills of the client. Art therapy requires an understanding between the patient and therapist that art is medium of communication between them. 9.4.2 Therapeutic uses of art therapy. Steps in art therapy. Art therapy follows different steps. It starts with assessment, that is assessing the problem of the client, collecting information about the client, and then deciding on the suitability of art therapy and then determining the specific technique of art therapy to be used. Next, rapport is established with the client and the therapist explains about art therapy and how it will be used in the therapy. The therapist emphasizes that he does not look for some artistic ability or artistic excellence by using art therapy, but the client must be genuine and free in expressing herself through the art form. Next, the client is encouraged to engage in the particular technique of art therapy and freely express. The therapist discusses the art outputs with the client to help her gain perspectives, derive meaning, resolve issues and conflicts. Finally, the termination phase is characterized by the end of the therapeutic relationship. Benefits of art therapy. Art therapy has many beneficial effects. The benefits of using art therapy has been found through many research studies. Patients diagnosed with breast cancer who were introduced to art therapy reported an overall improvement in their health, both mental and physical. Similarly, positive impact of art therapy was found in a literature review conducted by HUE in cases of employees under workplace stress who used art therapy for expression. A study conducted by Graves on patients suffering from brain injury within the age range of 24 to 71 found that 3 patients reported a decrease in their anxiety, 4 were found to be less depressed and 5 reported feeling less stressed. The study involved conducted 5 one-hour sessions and art forms like paintings, 3D figures and creating collage. Other studies have found effectiveness of art therapy in case of trauma and depression. Thus art therapy can be used in varied ways to improve our physical health and psychological well-being. It can help in medical conditions and also in case of emotional difficulties and psychological distress. Some points to remember in art therapy. It does not require the client to have knowledge and training about art. The client need not be artistic in her art performance. The therapist needs to be trained in art therapy. Art therapy is not limited to drawings but includes doodling, painting, clay molding, etc. One chooses according to one's preferences and therapeutic goals. Art therapy is not an art class. Art class focuses on teaching you the techniques of the particular art, for example, learning to draw, and creating a finished product. The goal in art therapy is free expression of the inner world. 9.4.3 Techniques in art therapy. The materials needed for art therapy include art paper or drawing sheets, plain paper / sheets, pencils, pens, color pencils, crayons, sketch pens, paint boxes, paintbrush, watercolor, color palette, clay mold, water, etc. Some techniques of art therapy using the above materials are doodling or scribbling, collage, free drawing, coloring, finger painting, sculpting, etc. The therapeutic goals of these techniques are to explore oneself, express one's inner feelings, and explore one's relation with the world. Example of a few specific techniques are: house tree person. Client is required to draw these three in one picture. It shows how the client relates the figure of the person to other two figures in the drawing. Draw yourself as an animal. Client is asked to draw themselves as any kind of animal or whatever they feel they can relate to. 3 wishes. Client is asked to draw 3 wishes of theirs. It reflects their maturity level and how they desire to attain these wishes. Drawing completion. Client is given incomplete drawing sheets where a few lines or simple shapes are there which needs to be completed and made into a larger picture. Activity 2. Daily draw your inner child activity. 1. Take deep breaths and relax completely. Have you paper and crayons with you? 2. Now close your eyes and try to imagine a child. Pay attention to the physical characteristics of the child like color of the eyes and hair, height or facial expression. How is the child standing? Next, imagine yourself wholehearted accepting the child as they are. Whether the child looks angry, heartbroken or scared. Now draw your inner child on the paper in front of you. There would be various different drawings of the inner child depicting different emotions like happiness, anger, sadness and fear. These inner children will want your attention and each deserve to be kindly treated and allowed to express themselves even if it may look immature. Inspired by Michelle Cassou, author of Kids Play, adapted to Inner Child. Ways to achieve optimum self-expression of inner child. 1. Regard and care for your inner child as you would care for a real one. Nurture it, be kind and have interest. 2. Creativity should be approached as process-oriented activity. Don't expect to get perfect drawings of inner child. 3. Avoid criticism or appreciation of the inner child's drawing. Use them for observations. 4. Don't ask for realistic drawings. 5. Don't ask questions asking your inner child to explain the drawings or what it depicts. By providing a safe environment, you will give an opportunity for full disclosure of thoughts and feelings. 6. Observe the process to show you care and are interested. This makes the inner child feel recognized and appreciated. 7. There should be no comparisons or competitions for inner child's work. 9.5 Play therapy. Play is a natural expression of children. It can be said to be the language of children through which they tend to express themselves. Play materials are the words or tools which facilitates expression and communication. Small kids engage in unstructured and spontaneous play which changes to structured play with rules as they enter into childhood, and then as they grow further, play also involves more abstract thinking. The simple leisure time activity of play can be used as a therapeutic intervention, especially in case of children and adolescents, though it can also be used in case of adults. Thus, when play is used as a therapeutic tool to help the child deal with mental health-related issues, it is called as play therapy. The Association of Play Therapy defines play therapy as the systematic use of theoretical models to establish an interpersonal process wherein trained play therapists use the therapeutic powers of play to help clients prevent or resolve psychosocial difficulties to achieve optimal growth and development. Play therapy originated from the works of the pioneers of psychotherapeutic approaches. While for Freud play was a way of free association, play was used as a psychoanalytic technique by Anna Freud and Melanie Klein, combining therapy and play when working with children. Hermione Hug-Helmuth is considered the first person to use play as a therapy in 1921. In India, we have so many traditional games which children play, such as Gilli Danda, Kanch, Chair Police, Ice Water, Hopscotch, etc., which have implications for the normal development of children. Play and children are associated inseparably. Hence emphasis is given on the playway method of learning in the early years of education. 9.5.1 Play therapy approaches. Psychoanalytic and psychodynamic therapies, Kleinian, Freudian and objection are the three main approaches to play therapy, and all are different from one another. Jungian play therapy. This approach focuses on the archetype of people and how it evolves over time. This approach wants to tap on these self-healing archetypes and involve them in the healing process during the play with the child. The child tends to believe the play area to be a safe space to display their unconscious feelings. Allen and Levy calls this approach to therapy as playing, making, doing, enacting fantasies. Experiential play therapy. Everyone learns through the experience they have, and this thought was conceptualized by Carroll and Norton. They theorized the concept of experiential play therapy, stating that children learn from what they experience in the world. They use these experiences for meaning-making through use of symbols and metaphors. During therapy as well, children start to make meanings and start to resolve their conflicts and issues. Adlerian play therapy. This approach was developed by Terry Cotman, who believed in 4 phases of therapy. Relationship building between the child and the therapist, where the child was guiding it, was the first stage, followed by developing understanding for child's behavior and his thinking. The next stage involved making the child understand the feelings being depicted in the pattern, and followed by the last stage, which involved helping and guiding the child to learn new behaviors and thinking process. Cognitive behavioral play therapy. This approach, developed by Susan Nell, involved the use of cognitive and behavioral methods for children in the age group of 2.5 to 6-year-olds. Various forms of art like role play, modeling, use of toys are used during the session to question and challenge irrational thoughts. Significant work was done by Shelby in the use of play therapy in case of trauma and depression. Family play therapy. This approach simply involved the combination of family therapy and play therapy. Use of caregiver during therapy session was done for the first time by Safer. Various different approaches to using family play therapy were later developed by Owen and Molly, followed by Griff, and more recently by Steve Harvey. 9.5.2 Therapeutic factors in play therapy. Erickson describes play as the most natural healing process in childhood. Play has developmental implications and promotes the all-round development of child. It helps in the physical growth, perceptual motor development of the child as well as cognitive, emotional and social development. Play helps in formation of newer neural connections and brain pathways. The benefits of play can be described as below. Helps in emotional expression, results in catharsis, releasing the pent-up emotions, develops self-awareness, helps in living through one's fantasies and fears, enables to learn how to form relationships and resolve conflicts, engages in creative endeavors. Thus play addresses all the dimensions of the self. Schiefer has identified 20 benefits of play which act as moderators in inducing positive changes in clients, modifying unhelpful thoughts and strengthening behavioral change. These are arranged in 4 broad categories such as a. Facilitating communication, b. Fostering emotional wellness, c. Enhancing social relationships, and d. Increasing personal strengths. 9.5.3 Material for play therapy. A variety of play materials are used in play therapy. The therapeutic playroom provides a safe and comfortable space to the client in which they explore and use the play materials. For instance, there may be soft toys, doll house, doll clothings, play truck, doctor set, cars, kitchen toys, building blocks or Lego blocks, Play-Doh, baby doll, toy knife, gun, etc. An important aspect of playroom is the sand tray or sandbox, which provides an outlet for the inner emotions of the child. The sand play therapy technique, first used by Margaret Lowenfeld, is expressive and experimental in nature. It gives expression to the internal conflicts and struggles of the client. The play materials provided in sand play include sand tray of standard size, i.e., 28.5 x 19.5 x 3 inches, toys, small figurines, miniature objects, water, spray water bottles and sand. Mostly these trays are blue in color to represent water in the bottom and skyline on the sides of the tray. Availability of diverse materials helps make it a robust play scene. According to Homier and Sweeney, the following categories of objects may be provided by the therapist either openly or in the sand boxes: mystical, crystal balls, magic wand, religious and godly figures, fantasy, cartoon figures, children's movie characters, treasure boxes, dragons, wishing well, unicorn, people, soldiers, doctors, family members, ethnic people, animals, insects, wild animals, domestic animals, extinct animals, sea animals, transportation, buses, vans, cars, air transport, water transport, buildings, huts, big houses, small apartments, lighthouses, fort, religious monuments, elements, wind, fire, ice, water wheel, etc., vegetation, small plants, climbers, trees, cacti, bushes, gates /road signs /fences, traffic symbols, rail tracks, barricades, natural objects, shells, pebbles, stones, landscaping, moons, stars, sun, tunnels, mountains, bridges, miscellaneous items, weapons, household items, kitchen tools, medical equipment. Some shadows and death figures can be added: sand tools, spatula, bucket. After the sand play is over, the therapist and the client jointly discuss the meaning of the art produced, the choice of various objects, the metaphorical meanings involved, etc. For carrying forward the therapeutic work, the therapist may rely on Freudian framework, or Adlerian, Jungian or other approaches as well. A disadvantage of this technique is the cultural construction of sand as dirty in some places, due to which some clients may dislike the idea of playing with sand. Certain important points to remember during play therapy: give freedom to the child to interact with the play materials. Do not instruct or impose directions. Initially leave the child to play with whatever he wants, later on introduce specific play materials, but allow the child to use the material in her own way. Child can be asked to provide descriptions of the play situations, provide encouragement and appreciation, explore things with the child, but confirm from parents. Also, limit setting or boundary setting is an important factor in play therapy. The child's imagination and flowering may be inhibited or even stunted in the wake of too many limitations, whereas excessive laxity may encourage unruly behavior on the part of the child. The purpose for which limits are being placed on the child in the therapeutic setting needs to be clear in the mind of the therapist. Some of the functions of limits are usually for delineating therapeutic boundaries, creating a reliable environment in terms of physical and emotional safety and security for both client and therapist, protecting the therapy room and its contents, and maintenance of legal, moral and professional standards. Demarcation of therapeutic limits also serves some psychological functions and helps anchor the session in reality, promotes cathartic experience for the child, allows more room for regulation and responsibility on the part of the child, and fosters positive attitude in the therapist. Besides the effective balancing between freedom and its limits, some of the other factors that play an important role in effective play therapy are length, frequency and number of sessions. 9.5.4 Techniques in play therapy. Children can engage in doctor set play, baby doll play, toy telephone play, toy construction set and so on. They can play using blocks, plush balls, and many other toy materials. Various puppets or miniature animals are used to help children express their thoughts, feelings, worries, anxieties and fears. They can engage in externalization play also by putting their fears etc. onto an external character, for example, a dog puppet. Researchers have described various play therapy techniques. Bubble breaths technique helps in relaxation and reduces anger and stress in the child. Beat the clock is a technique which helps the child to complete small tasks on time and get rewarded. It results in a sense of accomplishment. Balloons of anger helps to visualize anger and its effect if not controlled properly. It is useful for children who are aggressive or withdrawn. Garbage bag technique involves having a bag or container in which the child puts whatever worries her, or he feels anxiety fear depressed about. It can also be used as worry can or sad can or anger can. This helps the child in separating the issue problem at a distance, and the therapist then discusses these together with the child. Turtle technique helps the child to control their anger or just to pause for a while to regain themselves in case of any strong emotion. The turtle puppet can help the child to pause, go inside, and take deep breaths to relax. Role-play techniques are also used in play therapy where the child puts on masks or costumes such as superhero Iron Man or Spider-Man etc. and plays out things. Metaphors, symbols and stories can be used in play therapy to help the child articulate concerns, fears and fantasies that may otherwise feel overwhelming and produce shame, guilt and fear in the child. Using puppets and toy characters, stories can be formed which help the child share his/her concerns with others, assimilate disparate experiences to form coherence, and also to discover solutions to problems in the inner world. When children identify with story characters, they find it easier to give expression to their wishes, desires, hopes and frustrations through the characters. It gives them the distance necessary to completely experience and make sense of their own concerns and conflicts. Traumatic, suppressed memories may be uncovered from the unconscious, and the therapist works to reframe the stories in terms of coping ideas embedded in them, helping in reframing the trauma, pain management and finally finding a meaning in trauma. This entire process inaugurates insight, confers better self-awareness and transforms the client. Reframing stories helps in empowering and building resilience in the client. Play engages the imagination and is intrinsically satisfying. Traditionally, various modalities like music, drama, dance have been used in play therapy. However, journal writing, poetry, meditation, etc. may also be used. The basic idea in the use of all these expressive arts in play is to connect with subtleties of the inner world and giving them expression through writing, body movements, puppetry, art and craft, etc. It helps to calm the child, reduces anxiousness, brings in greater self-awareness, fosters self-confidence, and improves self-esteem, social relationships and appropriate socio-emotional skills. 9.6 Let us sum up. There are various forms of creative therapies. All these therapies have evolved as a response to various barriers encountered in therapeutic process where the therapist needs different, unique and creative ways to move past these barriers. Not only it helps in crossing such difficult points in therapy, but also these therapies have been found to be effective in coping and healing processes in psychological disorders and physical ailments. In all these therapies, the oldest is the music therapy, as it the most easily accessible to everyone and it is most unique to every culture. It has also been researched extensively in research literature. There is evidence regarding the soothing capacity of music, decrease in anxiety, reduction in pain, achieving control, calming neural activity and overall emotional balance. Art therapy and play therapy are highly effective in working with those clients who have difficulty in expressing, articulation of their anxieties and fears. These therapies have been found effective with patients suffering from cancer, coronary heart disease, brain stroke, etc. They provide ways to express their grief, verbal communication, release unconscious conflicts and reduce anxiety in patients. Hence there is ample evidence of effectiveness of music, art and play therapy, and the fact that helping client engage in art, music and other creative expressions has significant positive effects on health.